This is a very interesting job that you have, doctor, as a forensic pathologist. So you conduct a lot of postmortems, am I right?
Yeah. Yes. Postmortem examination is the core business for our services in forensic medicine.
Okay. So maybe you can tell us a little bit more about what happens when a body comes in. When is a postmortem conducted?
Okay, for an introduction, usually the body will be brought in by the police, and before a postmortem is to be conducted, the police usually will issue a postmortem order. It is the requirement of the law for the country. In all countries, they have their own legal requirement. For Malaysia, we comply to the Criminal Procedure Code, meaning that under this provision, any post-mortem examination to be done, it has to be directed or ordered by the investigating police officer. So once the police officer has issued the post-mortem order, to send the body to the nearest government hospital. It has to be a government hospital, meaning that a private hospital will not be performing the medical legal post-mortem examination. So once the hospital receives the body, we will usually register, and for doing the post-mortem examination, it's for Hospital Kuala Lumpur. The first step is we will subject the deceased or the body on for the CT scan examination, because Hospital Kuala Lumpur is the only hospital in the country with a dedicated CT scan to perform this examination. After this after the CT scan has been performed, then only we will proceed with the post-mortem examination. So all the post-mortem examination is under the instruction or order of a investigating police officer.
Oh, so there has to be a case to be able to do a postmortem on the deceased.
Yes, meaning that a doctor has no authority or has no right to instruct or order for a post-mortem examination. So it has to be a police officer under our law, the Criminal Procedure Code.
Okay, but can a family insist on a postmortem if they suspect foul play?
Indirectly, yes. What the family need to do is once they have lodged or report the case to the police, they will have to explain to the investigating police officer the need, why do they would prefer, and usually the police will take into account all the other investigation, and in most cases, usually the police will comply with that request.
Okay, so whatever it is, you have to make a police report.
Yes.
Okay, all right. But can a family refuse to do a postmortem once it's already been reported to the police?
Okay. If under our law, once the police has issued for the order, usually by law the family has no right. But usually we will use our discretion. We will discuss with the police, and based on case-to-case basis, we can offer what we call as a limited post-mortem examination. Meaning that we, based on our external examination, and also based on the preliminary CT scan examination, we can focus to a certain aspect of the body, say just focus on the chest or the abdomen or the head, and that's the best that we can offer to the family. It is a limited autopsy in certain cases. And in one example, we may not need to proceed with the internal dissection is in the case of a very bad accident, road traffic accident with obvious injury that is enough to cause death. In those cases, we can offer to the family by just performing an external post-mortem examination and just required to take blood for toxicology.
Right. In some cases, so postmortems are only done when it's a criminal, not always that a criminal act has been performed, right? Because sometimes if someone just passes away in their sleep and they're in their 30s or 40s and they were completely healthy before, when someone goes through the process of reporting that someone has died in their family, will there be a postmortem done if someone just passed away in their sleep in this case?
Okay. In this situation, obviously, if the patient were admitted to the hospital, attended by doctor, and somehow doctor managed to examine and diagnose the disease, usually there will be no postmortem requirement. But in other situation, for example, sudden death at home or in a hotel or in the street, and usually these cases will be reported to the police. And the first step, the police will perform a preliminary investigation. And to the best of the knowledge, if the police investigating the case is not able to come to a reasonable cause of death, he or she will issue a post-mortem order for the government doctor to perform the exemption. These cases usually, in cases of post-mortem exemption, there are only two main aspects. They would like to know whether the death is it due to disease or injury. If they are not able to determine, then they will ask for our assistance, the doctors in Ministry of Health, to assist in examining the body, more or less to determine the most probable cause of death.
Right.
Okay. Now, doctor, take us through the process of a postmortem. How long does the full process generally take?
In general, for non-complicated cases, we will be able to perform the post-mortem examination on average within about 2 hours. On average,
Okay.
plus minus half an hour. So meaning between 1.5 hours to 2.5 hours. But for complicated cases, say for example, a case of homicide with a lot of injury and so on, it may take up to 3 hours and so on.
Oh.
So, but for also another case, say for example, if we were to perform a post-mortem exemption on complicated cases, one of them is the high-risk autopsy like SARS or COVID, it go up to 5 hours. So in general, the usual case will be about not more than 2 hours.
Okay. So is it like, it is a very silly question, I need to ask this, but because if you watch a lot of TV and you watch CSI or you watch Bones, stuff like that, I'm sure you've watched it as well, Doctor. When you watch that, do you ever go, that's not how you're supposed to do it?
Yes, because in CSI, you have to complete the case within 1 hour. But our case may take days, weeks, or months. And usually in the actual practice, a lot of team will be involved. One of them will be the police team with their photographer and the officer. And at times, we may refer our case to the bone specialist who will assist us in the bone examination. If we were to find skeletal remain within the bush, then we may require our expert in bone to assist us. And also at times, even we requested for the dental expert to assist us in terms of examining the teeth for identification and so on.
So most of the time, TV stuff is all fake, lah.
Part of it true, part of it is just to
exaggerated, maybe. Yeah. So can you share with us, without too much detail, I guess, one of your most toughest cases?
There are several, but one of the most, not actually toughest, is very challenging, is to be part of or heading the disaster victim identification team for our country in handling the MH17 tragedy. Initially, our team was sent to Ukraine, and then later we were dispatched to Netherlands for the 1 month of ops in assisting the other teams doing the post-mortem examination of the deceased. So we were there for about 1 month during the fasting month with all the international DVI team, or we call as a disaster victim ID team, in trying to examine all the deceased. One of the main focus is to confirm the identity of the deceased so as that we can release to their families. So that was one of the very challenging part of doing post-mortem or forensic practice internationally. For locally, we do have several disasters because for Hospital Kuala Lumpur, ours is the center under the Ministry of Health. in any major incident in the country, our team will be the one who will be doing the coordination and assisting the team. We were involved with the Datuk, intrusion, and many other disaster events.
Yeah.
So in terms of the other challenging cases is in terms of doing the Kim Jong-nam case, we were involved because it is a very the first case for the country, and we're dealing with a very toxic substance, and we were very lucky that none of our colleagues were got any complication based on handling those cases.
Wow.
So when you talk about disaster cases, though, there's sometimes there could be some. Hopefully, it's not in the hundreds. How do you handle something like this? Because you mentioned one case, you need 2 to 3 hours, and in the case of, were you there during Highland Towers?
Yes, Highland Tower was my first involvement with the mass disaster management. That was in 1993. I was just a new specialist at the time, 93. So that was my first disaster involvement. For that incident, there were 48 victims. So because of the difficulty in recovering the deceased, it took about more than 1 week. So most of them are already badly decomposed. But on one other aspect, because it happened within the apartment, so more or less we do have a list of missing victims, and we do have families who could able to identify through their belonging. I mean, the effect, the IC, the clothing they're wearing. So we rely on what the deceased was wearing at the time of their demise. So it is what we call as a close disaster because we have the list of victims. It will be even more complicated, say, if it happened in an open disaster. For example, a stampede within the stadium. We have no clue who will be the victim.
Yeah.
But for Highland Tower, 48, finally within 2 weeks, our team, together with the police investigative team, we were able to identify all the victims.
Okay.
But how big is your team that can handle something that large?
Okay, for Malaysia, we are lucky because the forensic services is under the Ministry of Health.
Yeah.
So meaning that if it need be, we can mobilize all other team within the whole country. But for your information, even for Malaysia, we still do not have enough pathologists. For the country, we have only about 34. So each state, we do have a few.
Okay.
So in an event under one Ministry of Health, we can mobilize the team to support. So not like some other country, they're very localized and very small. But for Malaysia, because under one ministry, we have the advantage and the privilege. So we can handle any big disaster, but in a disaster, we would require the cooperation of many other agencies, the police and so on.
Now, doctor, how do you, this is a bit of a personal question, I guess, like how do you separate yourself from your personal feelings, you know, after these gruesome finds?
Okay, at the early stage of my career, I do have some, it did affect my personal feeling. You feel sad, you feel depressed. But after a while, going through the work and with many other agencies and colleagues, once we start with the work, we tend to be a bit more focused because our main objective is for the justice of the deceased. So our main focus is to assist the deceased, the family, and the police investigating, as well as the justice for the country. Because at the end of the day, it is our responsibility to come up with a report, and then the report at times will be presented in court so as to assist for the court to make the right decision. So with that focus in mind, once we get into the operational or the activity, we tend to focus on what we are supposed to do. I do agree at the early stage, it does affect, we do get depressed for a few days and so on.
How long did it take for you into the job before you started to get like comfortable with it?
I would say within 1 year. After a while, then you get used to it. Because once we get a case, we will assemble our team, and then we tend to focus on the job, then we tend to forget all those personal feelings. We have to deliver the best that we could for the family, for the police, as well for the court proceeding.
Yeah. Now, how important, like you said, we only have 34 forensics pathologists in the whole of Malaysia. Like, how important is the forensic pathology department when it comes to solving crimes?
In terms of solving crime, is mainly in terms of contributing to the investigation for the police. It is very important.
Okay.
Because especially in cases of homicide or murder, we will support or we will provide evidence. One is in terms of confirming the identity of the deceased. At times, it can be unknown. Usually, a document has been removed or body has been disposed and decomposed. So one is the identification can be a difficult part. And for identification, for fresh body, we can rely on fingerprint. At times, we rely on dental examination, provided they have dental charting during their when they're still alive. Third, we rely on the DNA test or DNA comparison, and also that one will require another set of sample from the close relative. So identity will be a very important aspect that we can assist for the police, because once we have the identity, then the police will have the lead where to start.
Yeah.
Second part, a very important part, is on determining the actual cause of death. As I have mentioned, it can only two main things, either disease or injury. At times, the injury is minor. Because of the injury, it can trigger a heart attack. So the main contributing will be the disease. But usually in most homicide cases, I mean murder, only three aspects, usually caused by assault or injuries or blunt force. Second, by sharp weapon, stab wound and so on. Third, by gunshot wound. So our role during the examination is to determine those injury, document the injury, taking photograph, and then document the pattern of injury, and then assist on giving the proper incident reconstruction, how it happened based on the pattern of injury. So we rely on the base of pattern injury, whereas the investigating officer will rely on the eyewitness statement. But for us, we examine, we document, we try to analyze the pattern, and then we will inform the police. Say, for example, the injury has been caused by a blunt hard object, such as a metal pipe and so on, or the injury has been caused by a sharp and pointed object, like a knife and so on. We cannot say caused by a knife, so we have to interpret based on the pattern of injury. So one is, and at the end of the day, we will provide a report submitted to the police for the police to proceed with the prosecution.
Okay. How about from a medical perspective, doctor? Like, why did you choose forensic pathology?
Okay. After a few years in the service, at that time, I met my senior in the university, 7 years my senior. He was the only one, the only pathologist for the country at the time. His name is Dr. Abdul Rahman Yusof. So when I met him, he encouraged me because forensic medicine is in need for the country, because for Malaysia, he can't afford to be just based in Kuala Lumpur, because the service will be provided for Semenanjung as well as Sabah Sarawak. So that was in 1990. So from then on, we managed to train more people so as to provide the service. As of now, at least all the state, we do have forensic pathology services.
Okay. What are some of the biggest challenges, though, faced by forensic pathologists?
The challenges in handling cases, especially a few. One is when dealing with homicide cases and with skeletalized or fragmented human remain. So the difficulty will be to assist the police in terms of giving the identity. Otherwise, it will remain unknown and the case will be unsolved. So skeletal remain and decomposed body will be difficult, very challenging for most pathologists in terms of, one is determining the identity. Second is to determine the injury if it were to be present, because decomposition and skeletalization will somehow destroy all this evidence. And also, it will also destroy evidence in terms of any toxic substance within the blood. So dealing with skeleton and decomposed body will be very challenging. Second is when dealing with medical cases, the peri-operative death, meaning died before operation, during operation, immediately after operation. So we will try to assist in terms, is it died due to the disease, or is it died due to the surgical procedure, or is it died due to whatever medication or drug that has been given. So it will be very challenging. It will have to be a teamwork within the pathologist, the surgeon, and the anesthetist to come to a reasonable conclusion. And also other cases, at times it can be especially deaths involving the young adult or young children. Usually they're supposed to be healthy. And at times we do perform autopsy, all will be healthy and no obvious disease. In those situations, usually it will remain as still unknown, but under the international classification, it is acceptable. Even after a full autopsy, everything normal, we will write that as undetermined or unascertained cause of death, meaning something that we still have not been able under scientific development to exactly determine what is the actual cause of death.
What is it? Is it a lack of technology that's helping you identify the cause of death in some cases?
In terms of dealing with death, technology more or less has been up to the maximum. Only the new, very fine or new disease that has not been, because the obvious natural disease that can lead to death, the sudden death, is usually heart or brain or lung. Very obvious. But once involved the children or young adult, it can be very difficult. A complete autopsy, negative finding. A complete lab test, still negative finding. A complete X-ray or CT scan, still negative. So we will put that as undetermined, but in bracket, meaning usually died of some form of natural cause, not injury.
Okay.
No,
Yeah.
Sorry, there are doctors, and then there are forensic pathologists. I'm just wondering, how do you pick who gets to be a forensic pathologist? Because you've got to have like you like solving puzzles and stuff like this in a way, because you're not just a regular doctor. What do you look for when someone wants to be a forensic pathologist?
Oh, okay. From my opinion, during my early years, I would prefer to work outdoor. At times because we were called to the scene of crime. Okay. Second, doing forensic work, we tend to work together with some other organization, with the judiciary, with the police investigator, with the scientists, PJ, chemistry lab. So during my early years, because just focusing on medical is not what I would prefer. Something like
Right.
Second is to have some investigative mind and not purely medical. So dealing with cases of accident, homicide, and also disaster. So those are the some of the criteria that would also determine whether you will be a suitable candidate in doing forensic medicine for the country.
Because I'm thinking of doing it. Because I like CSI.
You have to have a medical cert first,
that's
right?
true, yeah.
Like, do you think you have a more exciting job compared to just a regular doctor, a GP, or a normal surgeon?
If you ask the surgeon or the physician, they will say their field will be the suitable and interesting to them. But if you ask the forensic pathologist, we will say ours will be even more interesting.
Yeah. Now, doctor, after seeing so much death, right, do you still fear it? Can you hear me?
Speaker, okay.
Yeah.
Can you repeat?
Yeah. Now, doctor, after seeing so much death in your life, do you still fear death?
Of course. But but somehow after seeing we will really appreciate life. So in life, we will try to do our best to contribute to our family, our neighbors, our society.
Oops.
Oh, no.
So after seeing so many there, that there are things that while still alive, that we can still contribute to the community to the best of what we can offer.